Pelvic floor dysfunction is actually a disease that can be very tough to diagnose, but does affect a large part of our population. The way I think about it is there's a loss of coordination between the muscles and the nerves that help the pelvic floor work. The pelvic floor is basically a group of muscles that help the function of the bladder, the vagina and uterus in a female, and the rectum as well. These organs are all very tightly packed into the pelvic space, and they usually work in a coordinated fashion to help us to be able to go about our daily activities. Risk factors for pelvic floor dysfunction include aging, multiple pregnancies, any type of pelvic surgery, multiple deliveries vaginally, especially if you've had some type of episiotomy or tearing, chronic constipation, and there are some family-related factors as well. A lot of patients with pelvic floor dysfunction will present to multiple providers because sometimes it can be tough to make the diagnosis. Symptoms can include chronic pelvic pain, pain after bowel movements that can't be explained by colonoscopy, chronic constipation, or even leakage of stool or fecal incontinence. Patients can also have difficulty with urination or leakage of urine, and you may even notice what's called pelvic organ prolapse. That's when one of the organs that I've mentioned, usually the vagina, the uterus, the bladder, or the rectum, can actually fall through the pelvic floor muscles, and patients notice this. It can be very scary. The good thing to know is that usually the management starts with just altering your bowel habits and also some type of specialized physical therapy called biofeedback. However, there are some patients, especially those with pelvic organ prolapse, that would benefit from some type of surgical intervention, either with a colorectal surgeon, a gynecologist, a urologist, or we have a team approach when patients have multiple organs that are causing them problems. Fortunately, this can usually be achieved in a minimally invasive fashion through robotic surgery to minimize postoperative pain and really focus on the patient's quality of life, because treating pelvic floor dysfunction, in my mind, is really about optimizing quality of life and improving your daily function.